Thank you, Judy. Ko te rangi te maunga, ko Waipawa te awa, ko Ngāti Porou, taitanga mahaki te iwi, ko Leslyn Jackson, taku ingoa. Boy, I'm so glad that the technology is working. Look at that. Thank you. I want to start with just a few acknowledgements, and I want to start firstly by acknowledging and thanking Ronald Nepi. He has created the opportunity for us to do this work, and his leadership has been invaluable. I want to thank the team who I've worked with over the last 4 or 5 years, Lane Hyam, Lavi Potu, Alofa Ionor, and Debs Hancock. They've been amazing to work with. I want to thank everyone who worked as a navigator in the Navigator project that we worked through over the last 5 years. Those navigators taught us so much. Their work has been incredible, nothing short of incredible. And I'm so grateful to the providers that gave us a chance to work with them. Rewiti Ropeha, he was the first one that opened the door and let us put some navigators inside of his operation, and thanks for that, Rewiti. But there were 10 others. Tim at Tauwhi, I can see you here, Tim. Kia ora. Colleen at CCS Disability Action, Your Way Kia Roha, Ngāti Porou, Tūranganui Kiwa, both runanga had navigators based within them, and we learned so much from the experience of working together. My sort of nervousness this morning is not that I don't have anything incredible to share with you, but that I might have left something out or left someone out. And you've just heard from Judy, who I also want to acknowledge and thank for believing in the power of the work that we've done. Thank you, Judy. I want to thank the amazing researchers that have walked alongside us and published our work. I'm talking about people like Rebecca, who we're going to talk to later this afternoon, but also Julie Fry, Peter Wilson, Michael Roguski. We've had amazing support from people like Elizabeth Kirikiri. And the researchers that we've worked with, they get it. This is a hard spot to stand in because, as you can hear from the previous speakers, the future is exciting. It's still a little unclear, but if we're not going to, back ourselves and give it a go, then I'm not sure why we're here. But since 2016 through till now, we've been working towards that goal, quietly working with as many of you as we can to challenge what it is about the current system that doesn't work, and to learn our way forward, to discover for ourselves, if we had an opportunity to do it differently, what would that look like? What would we do? And how would we know we were on the right track? So feel free to stop me anytime. I tried to write a speech about 4 or 5 times and I failed miserably each time. So I'm going to just talk to some of these slides, and I hope that if you've got any questions and you ask me, we'll get through this together. Okay, so we know that the current system is built on some thinking, and it's some of that thinking's a bit dusty, it's a bit old now. Some of the things that put the current system in place is the notion that experts know best, that resources are limited, that decisions should always be made from the top down, and that the way that we're currently asked to measure social services outcomes by numbers, that reinforces what the system thinks it already knows. If it's funded counselling for 50 people and 50 people attend counselling, the system says to itself, see, we knew that's what people needed, let's just do that again. And it keeps going and perpetuating its own thinking. There's also this old thinking that says, if you help people, like if you really help them with what they want help with, they'll become lazy and dependent. Do they? So when we think about how did we get here, what questions does it raise when we look at how did we get here? Is it true? Do punitive measures really increase people's trust in our systems? Simplicity is an economics organisation that have recently done a survey. They copied a survey that happened in Australia and they did it here. And what they found is a profound lack of trust, not just in the government and in the media, but also in our NGO sector. When I heard that, I was quite deeply shocked. But I thought about it a bit more. And I read this piece written by a guy called Paul Taylor. I don't really know who he is. But he said, a lack of confidence turns into a deep community cynicism that nothing will ever improve. And cynicism is not irrational. It's a response to repeated systemic failure. And adopting a sceptical stance, it's the safest psychological path to protect yourself against future disappointment. But what it creates is withdrawal and apathy. In low-trust communities, what they found in the UK is that despair suppresses reporting. 58.2% of victims of antisocial behaviour didn't report anything. They didn't go to any agencies to complain about it. They just resigned themselves to thinking nothing will be done. So what's our experience been like here in Tairawhiti? Through the amazing navigators, and we've had about 16 navigators in total, and they were based in 11 different NGO providers, so a broad range of people from different backgrounds, working in different organisations, walking alongside Whānau with no restrictions to what they could do if they were asked for help. Unsurprisingly, what they evidenced was a massive failure of government systems to be able to meet the needs that people had. At least 50% of people not getting the help they needed. Not quickly, not easily, and in some cases, not at all. Sure, we could evidence disparity between government data on housing and what Whānau told the people they trusted in our community. Massive difference. And then the government changes the rules again, tightens the criteria, makes housing even harder to get into, makes it your own fault if you've contributed to the reason that you are no longer living under somebody's roof. That's what breeds apathy. That's what breeds cynicism. Local data tells a different story. The need is there, but the response is not. I've talked to a number of professionals recently who told me there's a lack of reporting of sexual violence in this community, and that's bloody scary to me. Are we that resigned that our justice systems, that our support systems are not going to be able to help victims, that they don't even bother? Because this is serious. Whānau have lost their trust. Our Navigator project was an opportunity for us to test some things. We wanted to flip the thinking. It's not always the experts that know the best. Often it's whānau who know best. And we trusted them, and we hope they trust us. Resources are limited. Are they? Are they really limited? We kind of think existing resources are enough, but only if we focus on doing value work and not waste work. If you haven't hung around anyone from Manaaki Tairāwhiti, you might not know the difference. Value work is the thing that a whānau asks you to help them with. Do that. Don't do the waste work. Don't worry about assessments, referrals, about processes that take you down a dead-end road and lead to nothing. Because government agency systems are full of those, full of that waste work. Oh, yeah, you might qualify, but you have to first go away and come back with some more ID. Oh no, we need another medical certificate. Yeah, we know you gave us one 3 months ago, but you need another one now. Oh, you haven't updated your details, so sorry, you're not actually on the waiting list anymore. We took you off. You have to start again. Make another appointment. That's what waste work looks like. It's frustrating. It drives all of us mad. And top-down decisions, how's that working for us? We've had decades and decades of top-down decisions working out what slice of pie comes here and how we do, how we are allowed to spend that, what we are allowed to provide for our whānau, and how we will be measured against what we've been told to deliver. Current measurement and reporting practices are very numbers driven. Why? So we can count how much money's been spent. It works better for a capitalist model to count units of service and people as recipients of those services. And so that's why we've been reporting that way for so long. But it doesn't measure if the job got done properly. It doesn't measure whether we actually heard what whānau said that they needed, or whether we sat with a tick box and crossed off everything they told us that met our ability to help them. So we do the best we can with what we've got, but there are so many things that still go unmet because we're so contained within a broken system. And the system focuses on individuals. You're the problem. You, the person, are the person who's complex. You, the person, are the person that doesn't know how to navigate our systems. Shall we give you a navigator? Well, guess what? We did that. Navigators can't get you services that don't exist. A navigator can't get you a house if there is no house for you. Don't get me wrong, navigators are incredible. We've seen some incredible examples of work, but the system's still measuring the failure of the person and blaming that person, and it's still measuring providers as though they are responsible for creating the outcome, when it's the government agency barriers that create the work in the first place. So what needs to change? We've proven through our prototype that we can use data and we can evidence barriers, and we can protect people's right to privacy. Now, I'm very sceptical about any talk about funding that requires providers to capture government unique identifiers. Watch out. If you haven't already been asked to do this, you may very well soon be asked to do so, because the government's current direction of being data-driven comes with a fishhook where we want to actually track individual people's use of services. But that doesn't tell you, if your system's broken, how to fix it. It just tells you how many doors a person desperately went through trying to get help. What you should be looking for is the evidence of why your system's not getting the job done right first time, every time. And you should be reflecting on your own systems and what it is you need to do to fix that. And we also proved that helping Whānau with what they say they need, it does not cause dependence. An analysis of 1,542 Whānau journeys that Manaaki navigators walked alongside Whānau with between 2019 and 2025 does not support the thinking about creating dependence. Most Whānau did not ask for further support once their needs had been met. Across this sample, 72% of Whānau did not ask again for support for the next 3 months or more once they got the help that they needed. And only 11% remained connected after a year, typically because they faced multiple unmet needs and a higher number of barriers in the government agency systems that they were trying to get the things they needed from, such as long wait lists, gaps in services, or very restrictive criteria. And only 2.5% of those 1,500 or more whānau continued to receive support after their original needs were met. And in those cases, it was because of long-term conditions like a permanent disability or a change in circumstances or a new and emergent need. You know, when you go to the GP, just imagine you go and you see your doctor because you're feeling a bit crook, and the doctor says, well, I can see you this time, but I can't see you again for the rest of the financial year because my funding is only, to see you for this issue, not the next issue. But we accept that that is the funding model that sits behind the social sector. It's bonkers. So, yep, we had a method. 2 rules: don't break the law, and then do whatever it takes. Rules are pretty simple, eh? Do whatever you can. Do what they ask you to do. In the current system, providers live in a land where the system assumes it already knows about you, and that it's only going to survey or research special interest groups to validate its approaches, and then it will apply some criteria, and if you meet their criteria, then you get the help you need. What the Navigator prototype tested was, let's just listen. If whānau have got something they want to ask us for, let's listen, really listen, without judgment, without a clipboard, without a pen, without needing to make an assessment between you say you need this and we've got this, this and this. Do you fit? And understand the context. There's often a lot more that whānau want to tell you, but you need to take the time to find that out, to listen, and to think about what barriers they've already faced before they come to you. The result of all of our data collection over 4 years tells us less than half of whānau get what they need. And it's an inconvenient truth, but what we documented is that it's government agency systems that drive the whānau needs, that whānau go to community organisations to get help with. If those wasteful processes in government agency systems were removed, half the work that we do in the community would disappear. Government systems make wrong assumptions about people, and they use pseudo measures to measure themselves against, to continue to make themselves look good. But all the measures in the world are useless if you don't make changes based on your data. That's a very old quote. So we tried really hard to capture the data, to analyse the data, to present the data in so many different ways. We created dashboards, long-form reports, visual reports, reports and presentations with moving flying dots, you name it, we did it. We were desperate for leaders to hear what whānau were telling us in order for them to change their systems. And here's what we learned. Power and control by the centre stifles innovation and resists all attempts to enable local system improvement. We've had some really good runs at it. We've done some incredible thinking and some incredible work trying to shift systems. But we didn't succeed. Or did we? It wasn't our system to improve in the first place. But we did everything we could to turn the mirror around and show the system its own flaws. Why didn't the change happen? Our local leaders, we had high expectations, but it was really unfair of us because they're locked out of changing national systems. They can't act on the barriers data we presented them. National policies are consistent nationally, but regionally unfair, like the accommodation supplement. Is it fair that if you've got the highest rents in the country, you should get the same amount as other communities where the rents aren't as high? We need the ability to change system conditions locally. And tracking individuals perpetuates blame. It doesn't help you find enduring solutions. And privacy of whānau data needs to be protected at all costs. Be wary. I think that is something that we all need to take greater attention to. So we faced heaps of challenges. Local leaders couldn't make the change we hoped they could. We had this ever-changing relationship with people at the centre. They change all the time. It's hard to keep up. And they never truly learn to understand what we're trying to do here. Local politics, it's a thing. And communicating from a systems perspective is really difficult when you are working with a sector who are conditioned to think with management perspectives. But we also had successes. We proved that whānau support can listen without judgment, can offer unconditional and flexible support, that we can build our own local data systems to see the whole of the system and how it behaves and how it acts. And we can share quality data and evidence. We created learning loops informed by whānau voice. When we proved that working around the system is not a long-term solution. You can fix a cog within a machine, but if the machine's still broken, you're still not going to get it to work. We built up a workforce who could document the real causes of pain. And we reported on that, trying to achieve some lasting change. So we talked earlier about cynicism, but there is hope, and I'm hopeful for the future. I'm hopeful that we don't have to wait for solutions to come from on high. The knowledge and the skills are here, in this room, in this region. And our local leaders are willing to do more. We've learned a lot about why we can't shift the current system. Do we even persevere with that? Or do we just say, nah, let's move away from that. Let's stop trying to fix the broken thing. Let's start for ourselves. Community commissioning might be able to help us do some more of that. We've tested and proved that our approach is locally, our listen to whānau, do what they ask us, don't waste our time and effort on work that doesn't produce results. We've proved that that's better. It's better for them and it's better for us. And we know that we can build our own tech solutions, and we know that we can get better at using tech solutions in the future. We've got a long list of how we can improve Uringi, our data platform. And we've done good things. So at the end of 5 years' worth of work, I can tell you, hundreds of whānau received quality support from navigators, and we can prove it. Our providers and our navigators created a community of practice. They proved that they can work collaboratively if they're given permission to do so. And we strengthened our data capabilities and our analysis experience. And now we have that. It will not be lost. It belongs to us. We can't unsee what we've seen, and we can't unlearn what we know, but we can put it to use in new ways. And we should be proud of our work. It's something truly to celebrate. So my heartfelt thanks to everybody who was involved in the Navigator work, from the navigators themselves and the providers that hosted them, to our governance group and leaders in Manaaki Tairāwhiti, to the wider community, but ultimately, my biggest thanks is to whānau who trusted us, that let navigators into their lives, that gave permission for us to use data that they gave us so that we could learn, to be better. And I hope that we're all working together to continue to do justice to the work that they've, the work that they've shown us from now and for a long time in the future.